challenges of cancer diagnosis, treatment, and survivorship. She received federal funding to help patients with thyroid cancer make an informed decision about whether to undergo radioactive iodine treatment and provide informational support to manage symptoms from radioactive iodine treatment. Also with us today is Dr. Cynthia McDonald. Dr. McDonald holds a doctorate in transpersonal psychology and has over 30 years of experience in mind-body skills, coaching and education, group facilitation, and meditation. She provides these services for several nonprofit cancer organizations in the San Francisco Bay Area and sees individual clients through her mind-body coaching practice. As a thyroid cancer survivor, she has helped hundreds of cancer patients prepare for treatment, manage stress, anxiety, and fear, retain a sense of empowerment, and integrate the cancer experience into a new normal. And with that, I welcome Dr. Carr and Dr. McDonald.
Thank you. Thank you all so much for being here today. I know it's the last day of this phenomenal conference. There's probably a lot of different information that you've absorbed. And Dr. McDonald and I are very excited to be here and talk with you all about the mixed messages that we often get from hearing this term, the good cancer. As the moderator said, my name's Dr. Carr. And one disclosure I would like to note is that Dr. McDonald and I collaborate on an NCI-funded research study to help thyroid cancer patients manage symptoms related to radioactive iodine treatments. So a disclaimer I'd like to note before we get started today. The information that we provide in this talk is for educational purposes. We will be doing some experiential exercises in the talk today where Dr. McDonald is going to lead us through a very lovely mind-body practice, which I know the keynote speaker gave us a little flavor of earlier in this conference. Any information that we share during this talk is not meant to be in replacement of any medical advice or directions. So if you are watching this talk, we strongly advise that you consult with your medical care team if you have any questions or concerns. And then, as our lovely moderator had indicated, I'm a licensed clinical health psychologist. So what that means is all of my training and background is helping folks who have a medical condition adjust and manage to life living with that health condition. And then I also wear a research hat at Georgetown University, where I do research with folks who have thyroid cancer and helping them improve their overall quality of life living with cancer. Dr. McDonald, not sure if you want to take yourself off mute and share a couple words about yourself.
Hello, everyone. Yeah, I'm so happy to be here with all of you today. As you can see, I am a thyroid cancer survivor as well. I'm coming up on 37 years. So I'm happy to share with you from my own experiences and also from the perspective of someone that has worked with thousands of cancer patients with a variety of different cancers and helping them use mind-body skills. And as Alaina had said, we hope that you will be actively interactive with us because that's where we could bring our collective wisdom to bear on the topic.
Yeah. So as the title of the talk says, we're exploring the mixed messages of the good cancer. And there's almost this idea of an oxymoron when you hear the word the good cancer placed side by side. So if we think about oxymoron, it's two opposing words placed next to one another. So good and then cancer. And when you hear this term, I'm curious what feelings show up for you, or if any of you have even heard of the term good cancer from your experience. So feel free to put messages in the chat, or if there's anybody in the room who's willing to share just a word or two.
Hi, I'm Allison. I'm 9 years out, but it came back just last couple months ago. And I feel really angry when they say it's a good cancer because it doesn't feel like it's a good cancer. And my body has gone through Hades and back. And I even hear it from some doctors, and it really feels very invalidating. Like, well, you're just not sick enough, you know. But it just, so that's just how I feel. I feel very angry.
Yeah, yeah. And thank you so much for sharing. We appreciate that. We are also seeing a lot in the chat that it feels dismissive. It feels like being devalued, and it feeling very much so like it's dependent on how you're physically doing, which isn't necessarily the case. So I'm going to go to the next slide. And Dr. McDonald is going to share some of her own experiences with this mixed message.
Thank you. And thank you so much for sharing that and for all of your messages through the chat. I share those feelings with you. And I'd first like to take an opportunity to just kind of parse out these two words that sit side by side, good and cancer. Cancer is a word, is associated, just like all of our words and all of our language is associated with a lot of feelings and reactions and thoughts that we may have taken into us subconsciously or consciously. And the word cancer is a loaded word in our society, in our culture, and in our experience. We know relatives. I've known many relatives, many friends who have had cancer and treatment, some who have not survived it. So when we hear the word cancer, we naturally and appropriately have automatic fear, automatic anxiety, automatic uncertainty. That's just there. And I experienced that too. When I was first diagnosed at age 32 years of age, I was not expecting anyone to utter those words to me. And it really provoked, I was terrified, basically. I was absolutely terrified. And then on the other hand, you have this word good. Well, the way we use good is it's a happy, positive value word. Oh, I had a good time. Oh, yes, she's good at her job. We use that to place a value on something. It's an adjective. So when you take the word good that has this implied positive value, and then you take the word cancer and you shove them together like that, it automatically brings up a lot of conflicted feelings and conflicted emotions. And some of these things, if you could go to the next point, some of these things that can evoke, that good word can evoke in us, we might in one hand feel like, oh, I feel fortunate. I feel some gratitude. I feel reassured in the moment. And that's the positive impact of hearing the word good cancer. That's what happened to me. Post-surgery, I was terrified. Post-surgery, I'm going in to talk to my doctor. I'm sitting across from him as a specialist, and I'm getting the report of my biopsy. And immediately he tells me, you have follicular thyroid cancer, but the good news is you have the good cancer. And I have to admit that in that moment, I walked in feeling terrified, but when he said the word good next to it, I had some level of relief. I was like, oh, okay, then maybe I shouldn't be so worried about it if they're saying that it is treatable. So I had this sense of ease and coping. And then if you can go to the next point, then within that same conversation with the doctor, I heard him go on. So I come in terrified. I hear the word good. I get a little relief, a little reassurance. Then we're continuing the conversation. And the next thing I hear is, you might even live until you're 50 years old. And when I heard that, I got really angry. And I felt really confused because I'm like, look, 5 minutes ago, you were telling me it was good. And now you're putting a ceiling on my life. I had all these conflicting thoughts, conflicting feelings. And then fast forward to some years after that. Well, let me back up. In addition, I took that good cancer and I started propagating it myself in my own conversations with my friends and family who were worried about me. So I started dismissing myself and my own diagnosis. Oh, don't worry, I have the good cancer, because I wanted them to feel less stress and to feel a little more reassured. So I was continuing by using it again and again and again. Later, fast forward, 20 years after that, because I'm a 37-year survivor here, 20 years after that, I'm talking and working with other cancer patients who have, aggressive forms of breast cancer and other types of cancer that are far more aggressive than mine was. And when I say I'm a cancer survivor, the first thing I'm asked is, well, what kind of cancer did you have? And then I found myself feeling guilty and feeling a little bit of shame, and even diminishing myself 20 years later as I'm working with a person, sitting across from me, that I have to admit that I had the good cancer. So all of this just to say that the conflict started from the moment I got the diagnosis, and then the good cancer, those two words, that oxymoron getting paired together, triggered all of these conflicting feelings within myself over time even. And let me tell you something. I was not clued into this when I was experiencing it. So don't think that I was this really mature 32-year-old sitting there and aware of all my feelings. I wasn't. I am looking back on it now. I'm looking back with wiser eyes and taking a look at the impact of this. So now that I've shared a little bit about what I've gone through, I would like to open this up to invite you to share with us, what were your mixed messages? What were your mixed feelings and your experiences when you heard these two words kind of pulled together? And how has it impacted you? Did it impact you in the moment and possibly over time?
And Dr. McDonald, we had two folks respond to exactly that in the chat. So I'll read the two comments first, and then we'll open it up to the folks in the room. So one person said, in the first meeting with my surgeon, he told me that I had cancer light. 4 months later, I am diagnosed with stage 3 thyroid cancer with possible distant metastases.
Yes. Yes.
And then the next person said, exactly. I tell my family I have a good cancer and I feel I am not being honest. It is conflicting.
Yeah. It really is. I could relate so much to all that you've said.
I would say my doctor, when I first got diagnosed 10 years ago with papillary, didn't say the words, it's the good cancer. She did say that this is a treatable form. She said, like, no cancer is good, but she said, you will hear people say that to you. But the way I sort of spin that, she said, is that it's a treatable kind, that they have come really far in terms of treatment plans for it. And the life expectancy is pretty good when it's caught early and all those kinds of things. She said, but no cancer is good, but you're lucky that this is one of the more treatable forms and we can be very aggressive and all those kinds of things. But I've also had the experience of having family members say, well, I don't understand. Why should we be praying for you? Like, that's the good cancer. And my response to him was sort of a very snarky, well, then you can have it. And you can let it affect your life and you can give it to your kids if it's not that big of a deal, because it's taking things from me, whether it takes my life, it's taking my time and my energy and my money and all these other things. So if you think it's that good, if there's a way I can give it to you, you can have it. So that's my feelings. It just makes me mad to hear people say that, just beyond angry.
I really want to applaud your doctor for framing it the way that she framed it. and also just want to affirm that I'm with you. I really get what you're saying. And yes, the anger is there. And I want to applaud you for responding to your family member and for speaking up and validating yourself, which is what you did, and your own feelings. Bravo
But
to
now
you.
mine has mutated from papillary, which, was what she was talking about, to anaplastic. And when she did tell me that one, she was kind of like, okay, sit down. This one's not good. This one's not kind.
Yeah.
And this is beyond my scope. And so I'm going to send you to the people who have a better, handle on how to help you with that. But yeah, no, it's just infuriating.
It is infuriating. And I'm so sorry to hear about how your diagnosis is progressing. And again, applaud your doctor for preparing you for that and for providing you with alternatives in terms of who is better experienced to work with you. And another good reason there for not using that terminology, good cancer, is because we don't know how our bodies are going to respond and react. We don't know. It's not like a snapshot in time, a diagnosis. It is a whole process. The body is always dynamic. It's always in motion. So to claim that it's good, that doesn't really capture our full experience because it can change.
Mhm. And just wanted to bring light to some folks who responded in the chat. One person said, my daughter was diagnosed last year as an 8-year-old, and I had family who said, well, she just takes a pill every day. That's easy. And then this person said, there's absolutely nothing easy about this. And another person, similar to the person in the audience right now, said, I tried to avoid saying good and instead saying very treatable. But even that sometimes feels like it downplays my experience.
Yes.
Yeah.
Yes.
Anything else you'd like to add, Dr. McDonald, in terms of this slide before we move on?
Not about the slide, but more about what people are offering in terms of the discussion, which is the one thing that the good does is it robs us of the ability to place our own personal value on our own personal experience, our own unique experience. And that's what angers me about that, is that it's like we are made as human beings to create meaning. We are the meaning makers and the interpreters of our own experiences. And when someone comes in, anybody, a doctor, a friend, a family member, and diminishes that experience by interpreting your experience for you by putting the word good or it's just or in any way, shape, or form that they're doing it, that's the rub. That's the anger of how dare you interpret my experience for me. At least that's how I feel whenever I have someone that is, interpreting and diminishing and placing a value when it's up to me to place that value on it and to give the interpretation of my experience.
So I just wanted to add that I think part of the problem is, like, when you're talking about doctors, I think it's unacceptable. And I've run into that. When you talk about our peers, like people in our lives, I think that society has allowed them to have this belief that it's a good cancer. And I found myself very frustrated feeling, so I'm a 13-year survivor and our son is a 1.5-year survivor. So, I found myself in a position where we wanted to guard him from any of that. Doctors were not saying that to him at all. His was aggressive. So the situation was far more, and I had people going like, oh, I had a cousin who had that. That's the good cancer. And I was angry that I had to spend any of my energy or time educating someone else. And then on the flip, I was like, if I don't do it, they're going to keep saying stuff like that. So that was, it's sort of like, I think as a society, we've allowed people to believe that.
Mhm.
And so, people most people aren't being jerks intentionally. I'm going to use the word jerk because that's how I felt in that moment. And to use the energy that you really should be directing elsewhere to be pissed off or educate people frustrates you to a whole nother level.
Yeah.
And
I think we can go on unless there's other comments in the chat on this.
one person did say, how can you correct a doctor? I have no problem telling off regular dummies that tell me this, but not a doctor.
That kind of is a good segue to your next slide, isn't it?
Yes, yes. So from more of a statistical standpoint, what is meant by the good cancer is that there's an excellent prognosis from the SEER data, which is a comprehensive database that really captures national trends for thyroid cancer and many other types of cancers. What they're able to find is that there's a 98.4% 5-year relative survival rate. And what that means is relative survival, it's an estimate of the percentage of patients who would be expected to survive after the effects of their cancer. However, what we're very much so hearing from folks in the room today and online is these are based off of large groups of people, and these numbers can't be used to predict exactly what's going to happen to an individual patient. And the SEER database also mentions that too. They have this exact disclaimer there. So no two patients' experiences are exactly alike. Their treatment and responses to treatment can vary greatly. I know that there are some folks who shared in the room today that when I was told I have the good cancer, and then down the line figuring out how I've responded to treatment, or there's been metastases, or I found out I have a different type of thyroid cancer, that really changes my experience. And what the literature also shows is what's meant behind saying the good cancer from the statistical point of view is it's a form of reassurance that in 5 years, there will still be a high chance of the individual living. So also want to give credit to what the statistical term is meant. But obviously, as Dr. McDonald had mentioned, as human beings, the way we interpret that term is quite different from what the statistics are saying.
And can I just add one thing before we go from this, because I want to answer the person's question of then how do you respond to a doctor who is using that terminology or some form of that phrase? And I would invite you to consider, if I were in your shoes and a doctor has said that to me, based upon what Alaina just shared, to say something like, I realize that you are saying this to me from a statistical perspective, and you're trying to reassure me, but right now, that really is not helpful to me. It would be more helpful to me if you would just tell me how treatable it might be and what my options are. And to somehow just to say, because right now, I just need to be allowed to feel my feelings. And right now, I'm feeling anxious about this. So I didn't want to go beyond the slide without addressing the question that came in. And maybe, Alaina, you have some additional suggestions for that question.
Yeah. So I also wear a clinical hat, meaning I see patients in therapy to talk about these experiences. And when an individual is faced with maybe a mismatch for the way they would like to have conversations with providers and what the provider is saying, even voicing that. I am someone who enjoys having more of a shared discussion about what this means. And even if that means that I'm going to be living in 5 years based off of the statistics, that's not the only metric, if you will, that's important to me. Maybe you are someone who has young kids and you're very much thinking about holding that role of being a parent, and maybe a partner to somebody, and also this cancer experience. That is equally important to talk about. And that does not necessarily mean it's good cancer. So finding different ways to voice, this is the way I learn best. And if there's a way to support my learning style or support how I communicate, can be really helpful to make it more of a two-way dialogue.
Yeah, the bottom line is we're always teaching people how to speak to us and how to treat us. And care providers and doctors are no different.
Right. I often say to patients I see for therapy, this is the first therapy session, I'll say this, there is not one approach that fits all folks. So if there are things that I'm describing or saying that isn't quite connecting, tell me. It's not going to hurt my feelings. The whole point of meeting is so that we can find ways to have you thrive in life and get to some of the things you are really wanting out of your life. So give me feedback.
Yeah.
All right. And we included some on this slide as well. There's been a lot of literature coming out as well where medical providers are acknowledging some of the negative impact of the good cancer label. So we've even had articles come out from the American Thyroid Association giving name to this experience that's happening for patients. So I think that there is more recognition of this happening over time. And like one audience member said, their provider used the word, this is a treatable cancer, which Dr. McDonald had also commended for that change in talk. So when we think about this human standpoint of being an individual, finding out that you have thyroid cancer, and then being told I have the good cancer from a human perspective, what this can do is it can set up expectations that don't match our experience. For any individual, when you hear the word cancer, that is a very intense, life-changing experience, regardless of what the 5-year survival rate looks like or not. It also preassigns this value of good to our experience rather than allowing us to define and create our own experience. I've often heard from folks that I feel like I can't complain or voice any issues I'm having because I'm supposed to have the quote unquote good cancer. And as a clinician, when I hear that, I often recommend not comparing it to another person's experiences. It's almost an apples to oranges approach. What you're experiencing matters, how you're feeling matters, and taking that at face value, regardless of what labels are being attached to it. And then also, when we think about this term good cancer, it can really diminish our emotional and physical responses. So setting up this either or thinking approach. I either have the really good cancer, and that's why I'm not experiencing as intense as physical symptoms, so I shouldn't complain about it, or, oh, I shouldn't feel as guilty or upset because this isn't as bad as X, Y, or Z. And that can, over time, really have some late effects of how this could be impacting you. So in other words, how you feel matters. It's not in comparison to anything. We're taking it at face value. So wanted to see if folks had any thoughts or reactions to that. I did see in the chat that there are some folks saying I find thyroid cancer support groups more useful to me than the general cancer support groups. I feel that I am among peers who understand. And then somebody else mentioned that too. They agree with this person's comment saying, it's like you're not a part of so many conversations. I sometimes feel like an outsider when I'm a part of more general support groups. And I wholeheartedly agree with that. I often tell patients that I see, I would recommend going to a support group specific to the type of cancer you've been diagnosed with. There can be lots of different group dynamics that happen where if you're in a general support group and you have a lot of folks that show up that day with a type of cancer that's not the one you're experiencing, the conversation can sometimes be overly clouded by that experience, and then it doesn't really utilize the time that you're hoping for. So I definitely agree. All right, I'm going to go to the next slide. So, not sure if anyone has seen the Pixar movie Inside Out, and I'm talking about the first one because I know that the second one has recently come out. And we've been talking about this idea of the good cancer, where you're having two very different experiences, opposite experiences happening at once. And I love the use of metaphors. It's often something that I incorporate in a lot of the sessions that I do with folks. And in the Pixar movie Inside Out, happiness and sadness, who are these two characters here, are talking about how a memory or an experience doesn't always have to have one emotion attached to it or the other. And in this particular instance in the movie, they end up holding on to one of the balls, which are representative of a memory or experience, and both of their emotions tap at it at once. So said in another way, you can experience this very impactful moment in your life and it be met with both happiness and sadness. You can also replace those emotions that I'm describing with your own, but it's really supposed to give this beautiful picture where you can have a very life-changing experience and it be met with a form of reassurance and gratitude and resilience, and at the same time, very understandable fear, frustration, anger, concern. It's okay to have both. Both can exist at once. Someone in the chat just said, my husband means well, but he always says, look, you have the good cancer, and I don't feel seen after this session. I feel that I can have a talk with him now to change this repeated comment that he makes again. Again, I know he means well. Yeah. That brings to mind, there's a different forms of communication. So sometimes with support systems, I often recommend if somebody is trying to give you advice and you're more so looking for someone to listen, even stating, I'm looking for more of emotional support, not problem solving. There's a great video I'll often send to patients, and it's of this couple having a conversation, and the woman in the video is saying, oh, I have this huge headache. It's hard for me to get through doorways. I keep having snags in my sweaters. And then it zooms out and she has this giant nail sticking out of her head. And the partner is sitting there going, but if you just moved the nail out of the head, everything would be resolved. And she responds and says, you know, it's not about the nail in the head. And then keeps going on. And it's a humorous way to show that sometimes with our support system, there might be folks that try and problem solve. And this is often the experience when you have a health condition. And you might not be looking for problem solving right now, or that might not be helpful. So sometimes even stating, this is my experience, and right now I'm looking for more of emotional support. it's a new muscle to start working, but it's very much so something that's okay to use in terms of communicating. I'm also being mindful of the time, so I want to make sure that we get to our experiential exercise that Dr. McDonald will lead. So I'm going to advance to the next slide.
Thank you. So as I've been listening to our discussion together, our collective wisdom on this, it comes back to, first and foremost, we need, and I will own it as my own, to not invalidate myself, not invalidate my own needs, my own emotions and what I'm feeling, and to not invalidate my own unique physical sensations or physical responses, and to make room for the entire spectrum of who I am as a human being, physically, mentally, emotionally, and all of the mixture of that, as Alaina pointed out. We seldom feel just one emotion in any given situation. We have a myriad of different emotions that can follow the whole spectrum. So one of the things that we want to do to prepare to move into the experiential is to do just a bit of reflection. So my invitation to you on this slide is for you to just reflect for a moment on what your positive experience or your positive response or reaction to that mixed message of any form of the good cancer message, to see if you can identify what your positive experience is in that. Perhaps it's a bit of relief of hearing it. Perhaps it's a bit of gratitude. Maybe it's not even an emotion that can be named, but maybe it's a physical response. Maybe when you heard it at first, your shoulders dropped a little bit. Maybe your body softened a little bit. But to just reflect on, what was my positive experience when I heard some form of that phrase? And then the other side of it, the cancer message, and your negative experience that could be associated with, again, that oxymoron of putting both of those messages together, good cancer, the negative experience of it. Maybe it was anger, as we've heard. Maybe it was anxiety, fear. I don't know what yours is. But the point of this is just to stop and pause and reflect to the wholeness of your being and to pull out your positive experience and then your negative experience. And once you've had kind of a handle on both of those. Someone just said that the positive was kind of like getting a good surgeon. Well, that is a practical thing that's excellent. And then notice how you felt when you had that. Touch into the feeling about that, which might have been a kind of a, wow, okay, I got someone really good here. That gives me some sense of confidence or some sense of I can trust this person. That's the emotional side of the practical experience. So you want to tap into the emotion, the positive emotion and the negative emotion. So once you've just reflected on that for just the time that I've been talking, if you just kind of keep those two in your mind, I'm going to go on to the next slide, to the next piece of setting up the exercise. So the next piece is kind of like a third point. If you think of a triangle like this, you had those two dualities of a good feeling and a not so good feeling as a result of the good cancer message. So once you've got those two polar opposites kind of sitting in there, there is a third point at the apex of the triangle. This third point is something that we all have the capacity to do. We call it in psychological circles and in meditation circles as well, we call it the neutral witness or the self-context. This is the self-observer. This is the part of us that sees and experiences. Even right now, you are seeing me, you're experiencing me, you're hearing my words, you're witnessing everything that's happening in this moment. Alaina mentioned analogy. A good analogy to this would be the neutral witness, this self-observing part of who we are, is like the sky. And just as the sky is broad and expansive and neutral, and the weather in the sky, the clouds, the storms, they're the content that can pass through the sky freely without harming the sky itself. And so that content could be likened to those two emotions that I had you identify, the negative and the positive. They are like clouds in the sky that are passing through this observer, this open sky that's very neutral and is just allowing these emotions, allowing this weather to pass through. So the key here is to get to the emotion. I see that someone says you don't have the support system that you wanted. And yeah, that's the situation. So then it's the question of, and how do you feel about that? How do you feel about that? Get to the feeling. How do I feel about that? So have that positive emotion, that negative emotion, whatever that is. And then that neutral witness and observer is the one that is looking at and holding both of those feelings at the same time without judgment, but just like the sky in an openness and allowing them to be what they are. So it would look, if you can advance to the next slide, visually, it would look something like this. You've got the two opposing, my positive emotion, my negative emotion. And then the step back and observe is this point at the top here. And from that, if you can advance to the next point, you have this open sky that's embracing and holding and allowing for both the positive emotion and the negative emotion to be what they are, to allow them to be there and allow them to pass through us, to pass through you. And so now that you've got the kind of the sense of the visual sense of this from the slide, I'm going to take you through an experiential sense of what this would feel like to actually apply this to those emotions. So just to get started, what I want to invite you to do right now is to get comfortable in your chairs, wherever you're sitting, or if you're laying down, whatever you're doing. And as you're sitting there, I just invite you to, when you're ready, just close your eyes, only because that allows us to focus inward. If you're not comfortable closing your eyes, that's okay. You can keep your eyes open and you can just focus, pick a focal point, like on the ground or with your eyes slightly downcast. Either way is going to be workable. And as you do this, I just invite you to go ahead and bring forth that observer within you. It's the part of you that just notices things. You notice your sensation of sitting in your chair. Notice your feet on the ground, the sense of your feet resting on the floor. Notice the sense of your seat in the chair. how the chair is supporting and holding you. You're just noticing the weight of your body in the chair, noticing your breath. And you're not changing your breath. You're just allowing your breath to just be there and just resting your focus of awareness on your breathing in and breathing out. Noticing when you inhale the coolness of the air in your nostrils and the back of your throat. Noticing the rise and fall of your chest or belly. Just being with that felt sense of your own breathing and your own rhythm. And if at any time the focus of your awareness pops back up into the mind, into a story, gets distracted somehow, that's okay. It's going to happen. It's normal. Just notice when that happens and then shift your focus back to the felt sense of being in a chair, sitting in the chair, breathing in and breathing out. That's right. And as you breathe in and as you breathe out, you're just noticing. Notice that positive feeling, whatever positive emotion that you identified. Maybe it was gratitude for a really good surgeon. Maybe it was a sense of relief that it's treatable. I don't know what your good emotion is, but see if you can sense into that emotion within your body. Where are you feeling that good emotion in your body? You're just witnessing it. You're witnessing the feeling and how it sits in your own body. Maybe it's a softness of the muscles. Maybe it's a sigh. I don't know what it is for you. You're just being invited to notice what that positive emotion is. And now expand that awareness that's as big as the sky, and allow that awareness to expand to include the negative emotion as well, whatever that is for you. Maybe it's a sense of anxiety, and you maybe feel that anxiety in your body. Maybe it's a tightness. Maybe it's in your belly, or maybe it's in your shoulders. Maybe it's anger. And notice where in your body you're feeling and sensing that anger and how it feels. And this might even be difficult. You might even have tears coming. That's okay. Breathe it in and breathe it out. You're just allowing this emotion to pass through. You're allowing this feeling and this felt sense of it to move through you. It's okay. Just breathe it in through the nose, out through the mouth. Allowing the feeling to be as it is. And then perhaps after you have felt through and touched into that negative emotion enough for today, go back to the positive emotion, the gratitude, the relief, or whatever that positive feeling is for you. And allow them to be felt side by side. As you inhale, as you exhale. allowing your experience to just be as it is. Notice your body sitting in the chair. Notice the weight of your body, the rise and fall of your chest or belly with every breath. Your feet on the floor, the temperature in the room, sounds in the room. And when you're ready, I invite you to very simply begin to move gently, move your fingers, toes, move your head and your neck very gently and easily. And when you're ready, just open your eyes. All right. Now I know things like this can be very different for every person. I'm going to hand it over to Alaina now and allow her to do a little debrief and close the session for us.
Yeah. Thank you, Dr. McDonald. So after doing an experiential exercise like this, it's helpful to unpack what was showing up for you. So it could be, maybe if this was your first time, our brains are literally meant to wander and think. So maybe it took a little bit of time to fully get in the exercise, and that's okay. That's neither good nor bad. That's just what's showing up. I'm curious if anyone has initial thoughts that are coming to mind that they'd like to share about their own experience. What was this like for you? Did it feel different from maybe things that you've done in the past? Was this your first time? Someone said, I tend to shove the negative in a box and set it aside. A little scary to let those feelings in. Yeah. And someone else said it's painful and I feel raw/weak, but I like acknowledging the feeling. And both of these comments are really important to notice. I find often in US culture, we are taught that there are certain emotions that are safe to express or to tap into, and those being happiness and being content, and then feeling frustrated. And when there's other emotions we experience, like fear, guilt, shame, an overarching message is, well, don't show that. Don't go in a corner in the privacy of your own home and feel that. And that's not always, that's very much so not the case, right? Having a diagnosis of cancer comes with all of these complex emotions, and it's okay to feel them. So this exercise is a great way to tap into that. We're also not saying to act on them. We're saying to feel them. Some other people in the chat said, after my initial diagnosis, I was angry. This year, I decided I was going to do things that make me happy and try to not linger on the anger. And I felt angry with this exercise. Yeah, so tapping into some of that, the negative emotion showing up. And then someone else said, I felt it in my face, just an elated feeling. My negative, I felt in my brain. I think this was representative of the mental process of the good/bad fight I was struggling with. Exactly. Sometimes our body will tell us first what's showing up before we can even know this is sadness, this is frustration. So doing this exercise, maybe you felt it more physically, and that's your body's way of talking to you. Right. So I wanted to advance to our final 2 slides. We have 3 minutes left. We've talked about a lot of different experiences that are showing up to the individual person. So depending on where you are right now in your own experience, it can be really beneficial to have supportive resources. We've had some folks in the chat discuss how they've really benefited from the ThyCa support groups because it's really touching on the unique experience of someone with thyroid cancer and having it be specific to those needs. I've attended some of these support groups myself when Gary Bloom has allowed me to, and they're phenomenal. So I cannot say enough positive things about them. So we have included these resources. If there's a documents tab for those attending virtually, and you can download this slide if you'd like. I also wanted to provide credible resources if any folks either here in person or virtually are interested in more of one-on-one support. Again, this really depends on where you feel like you're currently at. Psychology Today is a great resource, so you can search for therapists that have expertise with chronic health conditions and search by insurance. Some of the exercises we've done today fall within the realm of acceptance commitment therapy. So this is a type of therapy that has been shown through research to be helpful for folks who have chronic health conditions. Really tapping into allowing yourself to feel any emotions that are showing up, work through feelings of guilt, shame, etc., all in line with trying to find ways to live a fulfilling, meaningful life, thriving in life. So there's a directory of providers here. And then the American Board of Professional Psychology, this is like the gold standard folks who have completed the highest type of competency trainings to date. And there's a whole specialization for health psychology. So you can find folks based off of your zip code there. And then there's also a whole directory of therapists for folks who have health conditions, but also identify from certain sub-communities. Not only is it important to find somebody who understands your health condition, but also understands your lived experience as an individual. And then last but not least, I had mentioned that I do wear a research hat as well. So some of these exercises that we did today, we do have a section where Dr. McDonald does some exercises on what we call a website to help individuals who are experiencing symptoms from radioactive iodine treatment self-manage some of these symptoms. So if anybody is interested in potentially participating in this study, we do have our study email address listed on this slide. The study would involve asking folks to come into a virtual interview where you are using the website we've developed, giving us feedback, and then using it from the comfort of your own home to find different ways to self-manage symptoms. Some of those symptoms also include emotional symptoms from having treatment and living with thyroid cancer. So I know that we've gone through a lot of different things today. Dr. McDonald and myself are so appreciative that you took time out of your day to be here with us. Happy to answer any last minute questions, but thank you all so much.
Thank you. Thank you so much. And thank you all for sharing from your own heart and from your own human experience. I just really value that and really appreciate each of you.